What's up, guys? Dr. Seth back to help you solve your powerlifter problems. And for those of you who do not know, I ripped off my pec 2 weeks ago at Shell Shock, and I had that sucker put back on 2 days ago. And considering the surgery, like it feels pretty damn good already, and it already feels like very, very, very secure around the shoulder. I just can't do a heck of a lot with it. And for those of you who've been around a while, you'll probably remember my groin rehab last October where I ripped off my adductor longus, my adductor brevis, my pectineus, and my rectus abdominis pulled up off the pelvis. So there was a lot of shit gone from the pelvis. And with that groin injury, with that pelvic injury, the surgeons that I talked to, they all basically said the same thing that with the amount of stuff that was blown off, with the nature of the tears, if they were to go in there and try to sew stuff down, they would not be able to make it better. And with that groin not being operated on, I don't know if you guys will remember or not, but the initial stages of rehab were a hell of a lot more aggressive than I am being with this pack. And that kind of brings up the differentiation between like how we can treat things if the injury is non-surgical and it's a big injury versus if the injury was a big injury and it did get operated on. And the big differentiator is that, excuse me, just had to have some ginger ale. If the big injury is operated on, if my pack is put back onto my arm, the whole point of that surgery is to kind of like tack the pack onto the arm so that it stays there. And what we really do not want to do is have that pack pull off of the arm again because then we will have wasted the surgery. Whereas with my groin injury, even though there was a lot of shit ripped all the way off, if it wasn't going to get tacked back on, it was just going to scar wherever it's going to scar. And I wasn't so concerned with like letting stuff be in the right place because if it wasn't tacked into the right place, it never would end up in the right place. And secondarily to that, something unique about an adductor groin injury is that there's so much redundancy within the adductors and there's so much shit kind of close together that has similar lines of pull that even if stuff isn't tacked on into the right place, it's going to scar down to the adductor muscles and the other muscles next to it, and it will kind of be able to act through at least a similar line of pull so that function can be restored. Now, with all that said, with the groin, the big name of the game for me was I wanted to start being able to take advantage of that redundancy as soon as possible. And in doing that, I was squatting, I was doing split squats, I was doing step ups, I was doing RDLs basically as soon as I could. I was limiting range, I was using reverse bands at first just to allow myself to get in position, just so that I wasn't pissing things off too much. But I was using that thing basically as soon as I could because the goal was to allow the tissues to that were still there to adapt to the new demands that they would be placed upon them with the old stuff being ripped off. The secondary thing I wanted to do was as the old stuff started to scar down, I wanted to make sure that it did not scar down in a way that impeded range of motion, that impeded function, that got in the way of my hip actually being able to work. So I was super aggressive with it with those goals in mind. And the reason that I could afford to be aggressive with it goes back to the same thing again. If the stuff was ripped off and wasn't put back and was never going to end up back where it was, it really didn't matter what I did with it because it was going to heal where it was going to heal, it was going to scar where it was going to scar. And by moving it and by using it, I believe that I was able to positively influence how that scar tissue did form, and that's why I was able to come back so friggin' successfully from the groin basically imploding. Now, with the pec, on the other hand, with this pec being a complex tear, meaning that the tendon came all the way off the bone and the muscle came pretty much all the way off the tendon, there's anchors holding the tendon to the bone. There's also like stitching and shit holding the muscle onto the tendon. Now, if it was just like a simple tendon off, anchor down, I'd be a little bit more apt to be a tiny bit more aggressive because anchors holding tendon to bone, those are pretty solid, whereas stitching a muscle to a tendon, that is much less solid. And the whole point of the surgery being to glue things together so that they can end up in the right place, so they stay in the right place, so they heal in the right place. The absolute friggin' last thing that I want to do with this guy is have that stitching pull out or have the muscle pull away from the tendon or have anything pull away from anything else. So I am being extremely cautious with this, and this is probably the closest I have ever listened to a post surgical recommendation in my entire athletic career, just because I want to make sure that this thing does heal as well as it can. Because the whole point of getting an operation done is to allow it to heal as well as you can. And if you rush things beyond the healing process, if you try to load things too far, you're at risk of risking that operation. Now, kind of the same stuff that I was talking about with the groin still does apply though, because we still want to influence the scar tissue to heal and delay down in a way where it's still able to transfer load, where it's still able to, move and have some flexibility and not get in the way of shoulder function. But, huge but, is that right now, like 3 days post op, it is not worth pulling on it hard. It is not worth moving it around like crazy. It is not worth loading it at all, because I do not want to risk ruining what the surgeon accomplished inside my shoulder. And considering how solid it feels, like, it is actually hard to hold myself back because it does feel so good. And basically all I'm doing for it right now is I'm just doing little tiny shoulder blade rolls, pulling the thing around. I'm doing little tiny external rotations, little tiny internal rotations, little tiny abductions, just kind of going till I get a tiny bit of pull, tiny bit of sensation, and then I'm going back. And I'm just going to kind of keep doing that, keep expanding the ranges that I am working with. And as things heal, as things get more solid, I should be able to work with more and more and more and more before I get negative sensation. And, 2, 3, 4 weeks down the road, range of motion should start to look more normal. 3, 4, 5, 6, 7, 8 weeks down the road, I should be able to start actually using the pec more and more and more and more. And, 3, 4 months down the road, I should be able to actually start training it at a very, very, very low level. And that is kind of the rough plan to get me back to where I should be and where I will need to be in order to bench press. So, guys, that is how I'm treating the pec. That is why I'm treating the pec very, very, very differently than I had treated the groin. And that's basically kind of the framework that I use when I'm thinking about rehabbing a tear, whether it was surgical, whether it was non-surgical. And if you want to get more into this, hit the link down below, because I have the Bridge the Gap Between Rehab and Training webinar coming up this November. Early bird pricing right now, so take advantage of that before it steps up. Looking forward to seeing you guys there. Thank you so much for watching this, and I will keep you in the loop with how this rehab is going.